My good buddy James Sapirstein from First Wave Bio on Zoom today. James, how are you, sir? I want to give you First Wave Bio's stock symbol FWBI, and of course, you can go to firstwavebio.com. James, great to talk to you. I want to talk some more that we talked from last week, a little about what's coming up next for you guys. Before we do that, just for the folks that haven't seen you before, since we're on a new network, or an additional network, as well as some new affiliates, talk about a little bit about what First Wave Bio's mission is and what you guys are accomplishing about making lives better in the world of medicine.
Thanks. Sully, great to be on the show again. We have an enzyme that we use for cystic fibrosis patients who have trouble digesting their food. We've pretty much finished our phase 2 trials, and we're still interpreting the data from our last trials. But basically what this drug does, it competes against porcine-derived products that are already on the market. It's $2.75 billion market. And basically these kids have trouble digesting their food. They take anywhere from 15 to 40 capsules a day of the drugs that are on the market, the enzymes that are on the market. Ours is humanized. It would be far less capsules per day. So it's a compliance issue for us, which is favorable. And also, it's humanized. So there's going to be less adverse effects that you see normally with products such as animal-derived products. We also have another product called niclosamide, which we're studying for ulcerative proctitis. That program is currently on hold due to cash restraints, but we have two products in the clinic.
James, you mentioned the second drug, but what's the first drug called?
The first drug is adrulipase, again, it's an enzyme to help reduce. It basically takes the place of lipase. It's one of the enzymes needed to degrade the food and absorb it in your body.
James, we talked last week about how this is a quality of life sort of mission for you folks. It's not really a cure, although we're all looking for a cure. But this does increase quality of life significantly, because how many current tablets or pills these guys have to take that are diagnosed with this malady?
Anywhere from 15 to 40. It really depends on the child and the person. They start developing resistance to some of these porcine-derived products, and they have to take more and more as they become larger and older. So we know we can do this with far less capsules.
The outcome for this, with respect to you working in concert with folks trying to find a cure, where's that going, the cure side of this thing? Can you give a top-down kind of look at what's happening there?
Well, that's a great question. I'm not sure there's ever going to be a cure. It's just like diabetics. People have artificial pancreases and all those types of things. People have been working on this forever. So unless somehow we can introduce, or have the body produce through stem cells or something like that, and help grow these enzyme-producing cells in the body, that would be the only cure. So in essence, what we have to do is try to limit the exposure to how many capsules they take, also adverse events, and we can bring the quality of life into a good standard of living.
James, when you go back to that number 40, and it strikes me, especially if you're a young kid, having to take that many capsules, I would assume it's not like me mainlining M&Ms. It's just like 5 or 6 every hour, every couple of hours. I mean, you're kind of a slave to a clock, I would assume, with that many capsules.
Well, it's basically the capsules are very large. They're called zero-size capsules. So think about a large, omega-3 capsule. That's what they have to take. And they don't have to take it every 2 hours. Rather, they have to take it with meals and with snacks. So minimally 4 or 5 times a day. And depending on how they feel, if they take 4, for instance, with a snack, or they take 8 with a meal, if they're still not feeling well, they need to take more. And that's really what happens.
Unbelievable.
When you talk about this particular treatment, you'd mentioned the other treatments. Let's talk about where they are in the arc of the FDA scale. Let's bring up that chart once again, Jared, and then talk about where you're at in each one of these therapies that are currently involved.
So with the Drulipase, we are towards the end of phase 2. We did what we call a bridging study to see if our new formulation is going to be better than the old one. And in fact, we've shown that it is. However, we need to talk to the FDA about next steps. Will they let us enter phase 3? Will they have us repeat something? So that's where we are. We're hoping to schedule an end of phase 2 meeting with them once we have the final data report, which should come in about 6 weeks or so. With niclosamide, it's a drug that's been around forever. It's been around 50 years. We're repurposing it. So the ulcerative proctitis trial that we did didn't really reach the FDA standards, so we wound up not finishing it. And that's a trial that we bought from the company we acquired. But that's also in phase 2. We've got a couple of proof of concept trials out there, and we have to continue to finish phase 2. So we have 2 assets, both in phase 2.
James, before I let you out of here today, we got to talk about the COVID thing because you are our in-studio or in-house COVID expert and have been for a couple of years now. Talk about the, once again, like we did last week, what is the latest version called or the latest strain called? Are we going towards pandemic mode again? Are we in the endemic mode? Are we just getting a shot every couple of months or every couple of years? Give us an overview once again.
It's endemic. I mean, I forgot the exact number. It's E105 something. That's the name of the new strain. It's related. It's not related, I'm sorry, to Omicron. It's different. But Pfizer, Moderna should have their vaccines ready in about 2 to 3 months to be able to go out and vaccinate people for this new strain. What is good news, quite frankly, is the new strain that's infecting people. I believe it's about 600 hospitalizations a day, as opposed to last year, which was 10,000 hospitalizations a day. And people really aren't dying from this. It's really like a 3 or 4 day modality. It spreads quickly, but you don't get as sick as you did before. Obviously, people who are older or have underlying conditions need to be very careful. In fact, I read before I came on the air that the Hollywood studios are starting to mask people again because LA and your side of the country is starting to really have an uptick in COVID.
I may or may not have heard of a couple of people that may have had those symptoms over the last 3 weeks. I swear, I'm like feeling 100% for the first time in 4 weeks. I think I must have had it or something. James, thank you so much. As usual, James Sapirstein, Chairman, President, CEO of First Wave Biopharma. Their stock symbol FWBI. You go to firstwavebio.com. You'll hear from him again next week. James Sapirstein, of course, one of our favorite guys in the studio.